In what circumstances would it be advisable that a mother who is group B strep positive have antibiotics during labor? 1. If the baby is preterm. 2. If the membranes are ruptured more than 18 hours. 3. If the mother develops a fever of greater than 100.4. Under what circumstances would you be okay for your client who is having herpes outbreak to continue with vaginal birth? Birth can proceed vaginally if 1. The outbreak is non-primary. 2. Sores are external. 3. Sores are healing. 4. Adhesive surgical film or spray on bandage is used to prevent contact with baby. With lesions at the cervix, vaginal birth is prohibited. What is the usual course of treatment for chlamydia in pregnancy? The usual treatment of tetracycline is contraindicated because it can discolor fetal tooth enamel. Erythromycin is nearly as effective and considered safe in pregnancy. How is estimated due date calculated? Using Nagel's rule. Count back 3 months, add 1 week to the first day of the last normal menstruation, and add 1 calendar year. When is screening for thyroid disease indicated? Screening for thyroid disease with blood tests has become routine. Studies have shown a correlation between TSH and miscarriage, fetal death, and neonatal death. Normal TSH range is from 0.4 to 4.0. What might a finding of glucose in the urine indicate? Glucose in the urine is usually diet-related, but a woman with persistent positive readings in the first or second trimester may have an underlying diabetic condition. What are the dangers of congenital heart disease during pregnancy? The increased blood volume and weight of pregnancy puts strain on the impaired heart. What herbs can be used to treat back pain, sciatica, or carpal tunnel syndrome in pregnancy? St. John's wort oil or homeopathic hypericum 30C. What herbs can be used to treat anemia in pregnancy? Dandelion, nettles, kelp, parsley, yellow dock root helps to improve absorption of iron, and Floridex herbs plus iron is an excellent tonic. What herbs or homeopathic remedies can be used to turn a breech baby? Homeopathic postilla and moxa treatment. What can red clover leaves and blossoms be used for during pregnancy? Red clover nourishes the whole reproductive system and nourishes and balances the endocrine system. Red clover is rich in calcium, magnesium, and trace minerals. What herbs can be used to treat constipation in pregnancy? Psyllium seed, which can be added to cereal. Also, prune juice. Which herbal remedies can help with skin itchiness or pruritus? Dandelion root, yellow dock root. These are great as liver tonics and may bring relief. What herbs can be used to treat sleep difficulties in pregnancy? Skullcap or valerian tincture, hops tincture, and homeopathic aconite. What are the 6 herbs included in a douche for vaginal infection? Comfrey root, mugwort, peppermint, yarrow, rosemary, and alum. What can dandelion leaf be used for during pregnancy? Nourishes and revitalizes the liver, provides great kidney support, rich in calcium, potassium, and iron, and vitamins A, B complex, C, and D. It is essential to help in the prevention of preeclampsia and is a reliable digestive aid. What is polyhydramnios and what complications is it often seen in conjunction with? An excess of amniotic fluid. It occurs in fewer than 1% of all pregnancies, often in conjunction with multiple pregnancy, Rh incompatibility, or diabetes. Also, it is associated with fetal anomalies. What nutrition may be lacking in maternal diets if she's eating or craving excessive sugar? Excessive sugar intake may be a signal for more protein. What are the symptoms of placental abruption? Concealed abruption. Bleeding is not evident, but there is acute abdominal pain. The uterus is woody and tender to the touch. Marginal abruption. Bright red bleeding. Abdominal pain is less intense. Complete abruption. Bleeding is profuse and the mother will rapidly go into shock. What is a possible complication caused by polyhydramnios? Polyhydramnios can lead to premature labor. During labor, it can cause uterine dysfunction, placental abruption, postpartum hemorrhage, all from the distension of the uterus. Fetal malpresentation and cord prolapse are also not uncommon. What is a way you can confirm polyhydramnios other than with ultrasound? Check for fluid thrill by placing one hand on each side of the uterus, tap from one side, and see if it sends a vibration to the other, and then the test is positive. Also, difficulty with palpating the baby and difficult to hear fetal heart tones are associated with polyhydramnios.